focused on our hotspot strategy, the issue of subdivision of the rest of the districts into sub-districts for more intensive interventions. We have already sent the team of the Cuban specialists to come and assist in the Western Cape, and at this point we have about 28 of them in this province, and in fact I hope somewhere along the line we'll be able to meet some of them. And so that's been part of the support, and there have been other additional reinforcements. Some of the people, Dr. Crisp, that has been quoted, lives here almost. In fact, it does live here now. And then, of course, there's another Dr. Kirk and McCarthy, who works very closely with the teams supporting, particularly on the epidemiology side, as well as the issue of case management and other clinical management issues. The area that we had identified as needing a lot of strengthening in the provincial strategy has been the issue of quarantine and isolation. This is the area that I think we need to really make sure we focus on very strongly to ensure that we can cut the cycle, we can break the cycle of the infection. A lot of discussion has gone into this, and we have seen how various departments have come together, particularly public works, tourism, environment, who have offered additional beds so that we can actually reach the numbers that we need to take the people out to quarantine and isolation. This now adds on to what the provincial government has been doing. They took me around to show me some of the areas where people are going to be taken. I still think that we need more beds. I have said to Minister Delile, Minister Krisi, and Minister Kubai that we need to really push to up to close to 30,000 beds. The focus, the President, has got to be on those who have turned positive in the past 2 weeks. That's where the large source of infection is coming from. So we are not only dealing with the positive cases, we're also dealing with the contacts. And so this is the area where we believe we're going to make a very concerted effort to reach out to breaking the cycle of the infection. Fortunately, there has been a very good test case here in the area of Witzenberg, where we have seen that, in fact, that has worked. Now, this has been also the effect in some of the parts of the country. Bloemfontein or Mangaung was exactly the same. It was a raging epicenter brewing, and we had to deal with it. And the containment, both in Durban and Gauteng, particularly in Joburg, has been really the area of intensive quarantine and isolation of all contacts, tracing the contacts. So there was a gap in the province, and I'm glad to see that it's being now covered. The focus on vulnerable patients that have been seen through is in addition to that strategy. It's a very important one as well, because one of the major factors in the morbidity has been around the additional comorbidities which are associated. The issue of testing, we've discussed it several times at all levels, and I have said that I want to make sure that it becomes a very temporary problem. As President would be aware, the President has actually opened for us a whole new platform for the whole continent to try to be able to have access to additional test kits, and we believe that we'll be able to make an impact at that level. There's also additional kits that we have just released from customs last night that comes from Russia, from Russia, and we believe that all of this together will actually help us to close the problem of testing. As far as I would be concerned, President, this issue has to be seen as a transitory problem. Although we have tested quite a number of people, the numbers need to be increased. We need to target a bit more and make sure that we don't compromise the case management. And in this case, targeting has to be seen in the context of ensuring that every patient who has to be treated, the results are available despite the fact there might be backlogs, so that their treatment is not compromised. And all of that, all of us are agreed, and the approach has to be that we will still clear the backlogs nevertheless. The issue of oxygen is, again, not a Western Cape issue. It's a general country matter, and so the Ministerial Advisory Committee has made certain proposals, and so we are looking at working together with Minister Patel and other ministers to actually approach the relevant industries to deal with that issue. The issue of birds, I'm glad as well that President is here to witness, to actually see some of the birds that have been rolled out, and the numbers of birds are actually quite encouraging. However, we've seen that because of the way the surge has happened, it has moved a bit quicker than what we initially thought. So we thought there was now a shortfall on the birds, but already we have had an agreement with the private sector to assist the province. On Tuesday, we conducted a meeting with the private sector. All the private sector players were in the house, and we then have agreed that the province is free now to actually go and procure those beds. So the 300 beds are a stopgap measure to cover in the event the province needs more beds than our beds are ready, and therefore that covers from that possibility. But we've also gone beyond that point to make sure that there's standardized protocols that have to be followed as we refer the patients, so that we ensure that patients, we as government, public sector, will decide who goes to be referred to the private sector. But we have also made it very clear that the treatment is not going to be different between public and private, and so that area is actually taken care of, President. We will continue to work on it. We've actually said that the province must conclude service level agreements with any institution that they wish to work with, and this is the case in the rest of the country. Of course, the pressure is not the same in the rest of the country as it is here. The area of healthcare workers who are affected, President, is a matter of concern. I think Dr. Klute has clarified, has actually explained the challenge. But in fact, President, in the whole country, up to the 28th of May, the numbers of health workers who were infected would be 2,084. This is both public and private. And out of this, Western Cape is responsible for 80% of the health workers. And so that's really in keeping with the fact that this is now the epicenter in the whole country. And so whether we're looking at public sector health workers, which is about 80.7%, or the private and public sector together, which is basically about 81%. So that is really the feature in this province. That raised, therefore, the question of additional support, and we had this discussion with the MEC Mbombo and Dr. Klute, the HOD, that we now needed to get the call, to make a call to the rest of the other provinces to give support. And already now you will notice that of the new recruits that are coming, a number of them are coming from outside other provinces such as KwaZulu-Natal and some of the other areas. And this is going to be the trend everywhere, because the numbers of the demand on the nurses is going to be increasing. The Eastern Cape, we also 2 weeks ago got them, I think President was there, they'd already taken in over 800 new recruits, and the number also, similar number has been done here. We have gone further, President, and this has been again the work that we've been doing and led by Dr. Nicholas Crisp and Andrews in the head office. We have actually approached the private sector. So we've got a general broad agreement now with the Unity Forum for Family Practitioners, which is to agree that we will work together and bring in private sector players at every sub-district so that they can work and support our teams. And in this case, we've got a whole program that's going on now to look at the particular conditions under which they do the work. We've also been approached by the specialists who have also come on board and said, look, they also want to work with us. Obviously, their main issue has been around how they're going to be pushed into doing more work than which is outside some of their scope in terms of it's COVID, but everyone else must now focus on what to do on COVID, even though they are not necessarily physicians, internal physicians as such. So the issue of medical legal claims and the issues of lawsuits is under discussion, and we're discussing that issue. But we have therefore said that the province should be free to open up to recruit additional doctors from South Africa, and we've looked around, we're working with the Medical Association. They've just given me a list, and we've said we're not talking about general any doctor, we're talking about those who are registered with the Medical Council or the Health Professions Council. We're working through that number. So, nurses, doctors, and other healthcare workers must be recruited, and therefore the question that where there's a limit, we also will have the overlap coming from the private sector. That we have agreed, President, as your instruction. This is a health sector. Both public and private were actually doing exactly the same thing, and so we're going to work together. That raises, therefore, the issue of the budget, which I think is a general point that we have said, that President has said that there's going to be a readjustment of the budget. The Western Cape, President, remains the epicenter in the whole country, which is now responsible for, of the 40,000 people who are positive, 27,000 are in the Western Cape, which is 66%, too high for the proportion in terms of the population. But it tells us that the trend of the infection can grow in any kind of direction, and in this case, it's also matched with the numbers of deaths. At this point, of the 848 deaths, the latest figure, 651 are from the Western Cape. That is 77% of the deaths. So we would be concerned that these numbers will obviously be rising in the next coming weeks in every other province, and the indications are that the numbers are going to be rising, and so we're looking at all of that. Of the tests that have been done, we've done over 820,000 tests, and 23% of the tests have been done in the country are in the Western Cape, and again, we have given more priority to the Western Cape to deal with the fact that there shouldn't be a limitation because of where the epicenter is. So largely, President, I think that we're working closely and tightly on this issue of containment. What I've found to be also quite important is how the multi-sectoral teams have to be, activated everywhere. I was laughing in the Witzenberg area. The presentation was done by Dr. Meyer and went through the whole thing. And I said to myself, this is how the district development model works, where you get someone who is now attached into the district and actually presenting as though he was actually the director of health in that particular area. So I think that in the next few weeks, we're likely to see MECs, ministers, mayors, everyone telling us specifically about what the trends are on COVID-19, because you have indicated, President, you'd like all the ministers and the MECs to go and support the community at the local level. So I do want to say, President, I am very much happy that President is here, because it also is important for the support of all the health workers in particular, but also for the provincial government. And we do get into quite robust discussion, President, and what we have here are issues where we're quite clear that this is the way to take the fight forward. So, President, I'd like to leave it at that and just say that I am also very grateful for your presence, and also thanks to the Premier for all the support, and of course the whole health team here has worked very hard, and we work as one team. There's only one campaign, it's anti-COVID campaign. This is South African campaign, it's one country campaign, and therefore it's one Department of Health, and work in that way. Where there are issues, we sit down and try and see how to make sure we support each other. Thank you very much, President.
Thank you very much, Minister Dr. Mkhize. I'm going to go straight over to the President. President, thank you very much. I think, Mr. President, just give us 1 minute. Can I get a technical person to come and have a look at this mic, please?
Thank you. Thank you. Thank you, Premier Alan Winde. Let me take this opportunity to extend my greetings to you and to your MECs, and also to the ministers who have accompanied me on this visit. I'd also like to extend my greetings to the religious leaders who have graced this occasion, and thank them dearly for offering the prayers and the intercessions with the Almighty God for this most important occasion. And we want to thank them for continuing to intercede on behalf of our nation, our people, with our Almighty Being, to enable us to navigate our way around this pandemic. Their continued prayers and presence amongst us is not only a strengthening moment or effort, it is also enabling us to be able to handle this pandemic with determination, and so we thank them, and all of them. I'd like to thank you, Premier, for your leadership. Your leadership has been quite forthright. We've seen how you've, with great determination, been leading our fight against COVID-19 in this province. So we thank you for that. And let me also thank the officials who have been working fervently, from all the health workers who we thank, and many of them have been making sacrifices, life sacrifices. We've lost a number of health workers in this fight against COVID-19, and they are putting their lives on the line in order to save our lives. And we continue to thank them, and we want to strengthen them and make sure that they are strong enough to continue this fight. I'd like to thank our police as well as our soldiers who are enabling us to manage this pandemic. And of course, we have to thank the media. They have been devoting a great deal of time and effort in spreading information about all the work that is being done in this fight. I'm rather glad that we've got national cabinet ministers who have come down on with this visit. Minister of Police, because Minister Zweli has a lot on his hands together with his commissioner here. This is a part of the country where the police have had enormous challenges, and we're glad that he can be here and he visits this province on an ongoing basis as he does his work. But we're rather glad that he's also here, and the Minister of Public Works and Infrastructure, Minister Delil, also has her job cut out, because we need to be setting up hospitals, field hospitals, and she needs to, and she is giving a lot of support in all this. Minister of Water and Sanitation, Minister Sisulu, I'm glad to hear that water is being made available on an ongoing basis, and that is pleasing. And Minister Mkhize, Environmental Affairs, is here, and Western Cape is an area where environmental matters, particularly along our coastline, also is important in the fishing industry. So that is also key. Minister of Transport here in the Western Cape, particularly train transportation is a major challenge, and I'm glad that Minister Mbalula is here. Other ministers were supposed to be here, but they are also engaged with other matters. Minister of Defense and Military Veterans was meant to be here, as well as Minister of Basic Education. We're rather pleased to have this opportunity to receive this report, and I'd like to congratulate you for presenting such a thorough and well-prepared presentation that has given us a very broad introspective look at what we are doing here in the Western Cape. The Western Cape is the epicenter of COVID-19 infections, and this concerns us deeply as leadership of the country. And it is for this reason that we felt it necessary to come here, because we need to address this, and I'm glad that your presentation has identified a number of interventions that you've embarked upon. And I'm also glad that Minister of Health, Dr. Mkhize, has spent quite a lot of time here and has been interacting with you on an ongoing basis, and as recently as a few days ago. And we are pleased that Minister Mkhize and his department and all those that he works with are going to remain focused on what needs to be done in this province. Minister Mkhize's work is quite intensive and broad, and he has to be in all places at one go. And as you correctly say, he is our minister who is virtually in Geneva, but has to be in all parts of the country. And we want to thank him for continuing to lead the charge on behalf of our nation, and also focus here in the Western Cape. I'm also pleased to see that at the provincial level, the government is working extremely well. You continue to meet regularly. That is very, very pleasing. But I'm also pleased to hear that and to see that you're cooperating well even at national level. There have been suggestions that the Western Cape has always wanted to excise itself outside the broader realm of national government interventions, but you've demonstrated that you are dynamically linked, because the Western Cape is part and parcel of South Africa. We are a unitary state, and Western Cape cannot be seen to be charting their own path. And as we face COVID-19, it is very important that that cooperation is at a deep level with the Ministry of Health, as well as all other departments in our government. And Premier Windy, I'm really pleased that under your leadership, you are ensuring that that cooperation is effective and carries on at a very deep level. I, for myself, I know that we work extremely well together, you and I, and I'm rather glad that the Western Cape can continue doing precisely that. And you at the Western Cape, you've been a leading province in strengthening the district development model, and it is through the district development model that we will be able to have a much more effective management of COVID-19. And if we strengthen that level of working, we will be able to ensure that what we do is most effective and does not lead government to areas of weakness. COVID-19 has also given us an opportunity, which is clearly demonstrated here in the Western Cape, to work with other role players, to work with NGOs, to work with religious, faith-based organizations, and to work with all manner of other entities that have an interest in ensuring that we address COVID-19 properly. I'm glad to hear from your presentation that that is something that you have embraced, and indeed we need to be working together with key role players in our society in everything that we have to do. I have received your letter, and your letter sets out the key challenges that you are facing here in the Western Cape, particularly when it comes to staffing challenges as well as the funding. Let me immediately say, as Dr. Mkhize has said, the staffing challenges must be solved. We are at war. We are fighting a life and death war, and staffing challenges must be solved. We must identify, headhunt, and find all those staff members that we need to bring in. Cost is not the issue here. Saving lives is the main issue. And that must also apply here in the Western Cape. When I went to the Eastern Cape, they were running short of a number of health workers they needed to bring on board. We immediately said, together with Dr. Mkhize, that they must go out and find those health workers so that we can manage COVID-19 properly. And similarly, I will say here, not having enough staff members is not going to be an excuse that I will accept. We've got to find them. Money is not going to be the issue. We must pull out all stops to save lives. This is a war that we must win. We cannot sit back and be defeated by COVID-19 on the basis that we didn't have enough staff members. Department of Defense and Military Veterans, Dr. Gulube is here, who is the Secretary of Defense. They are on the ready to bring in defense military personnel who will be able to come to this province immediately to come and lend a hand. And we must also find staff members in various other provinces, and Minister Mkhize will make sure that they are identified and they are brought here. You've alluded to the fact that one of the challenges that you're going to face is beds. Now, I've heard your account in your presentation about the number of beds. I still think that faced with the challenge that we have of greater infections, up to 66 infections in the Western Cape, and having had 77% of the deaths in the country, you will need, and you do need, more beds. We must increase the number of beds. I'm not satisfied with and happy with the limit that you think that you're going to have. We must increase the beds. It's better to over-provide rather than to under-provide, because the worst is still and is yet to come. We therefore must increase the number of beds. This is the one issue that I am not particularly happy with. I would like to see a margin above what you are providing for, so that we are constantly on the ready. When I went to KZN, they had also under-provided the beds that they were going to make available, and at that point we said they need to increase those beds, and they have responded positively, and the beds are now going to be increased. It's all very well to work with models. Models will tell us this and that, and they all work on the basis of probabilities. And I think in terms of our governmental management of this pandemic, we must always be ahead of the curve, over-provide, because if we don't do that, when we have a rush or an increase of people who need beds, we should never be found wanting. In this case, Because we are at war, we should never be found wanting. Let us make sure that we pull out all stops and we provide more beds than we may need on the basis of the models that have been built by a variety of people. I'm pleased with the way you are approaching the differentiated strategy where we've identified hotspots. Premier, you earlier told me that the focus that the hotspot strategy that we outlined is now being used for a place like Witzenberg is already showing great results. I'm very pleased with that, and I'm pleased that Minister Mkhize had an opportunity to look at that as well. This is precisely what we want to see in all the hotspots, where our interventions and our solutions are focused on each of the hotspots, because it already shows, going by the Witzenberg case, that our hotspot strategy is the correct one, and let us intensify it and begin to apply it in many other areas that are hotspots. Because our task is to continue flattening the curve, and flattening the curve is not a one-day event. It is an ongoing process. It is flattening this curve. We're not going to be able to eliminate this pandemic at one go. It is going to be and stay with us for quite a long time to come. We therefore need to identify areas where there are hotspots, focus on those, and use all the tools that we've got in our toolbox. One of the issues that I did not hear very clearly being articulated here is contact tracing, because it is when we upscale our contact tracing that we will be able to follow through all those who are infected and the contacts, and isolate them, quarantine them, and make sure that we are able to flatten the curve on an ongoing basis. And of course, testing has to be upscaled. I know that you've got a backlog of, say, 27,000, but we've got to upscale it. And as Minister Mkhize was saying, we're now going to be able to procure testing kits through this platform that we are launching in a few days for the entire continent, where we will have up to 30 million, well, 60 million for starters, test kits for the entire continent, and where we will have those 30 million test kits being made available every month. And this is a platform that's going to enable our own manufacturers here in South Africa being part of the platform, and a number of other countries on the continent, as well as the offshore ones, be it China, be it Russia, and so forth. We will all be able to buy through this platform. So soon, our challenges when it comes to testing kits is going to be resolved in no time, and we should then be able to continue with our testing. But it's important that the screening campaign that you were showcasing here should continue, particularly through the community health workers, who should be spread throughout the province, in the townships, in the various places. They should be spread throughout. One of the ways in which the infections have been spreading also here in the province has been through lack of sufficient social distancing. And as has been reported to me, it's been in shopping centers, in malls, and so forth. We now need to embark, and your presentation raised it, on a massive communication campaign, so that the level of awareness amongst our people should be raised exponentially, so that they become more and more aware of the need for social distancing, wearing of masks, cleaning of hands, and all the protocols that need to be put in place. The same thing should obtain in workplaces, particularly in the farming areas. That needs to be embarked upon. Lastly, you have in your letter alluded to the fact that funding is needed. Yes, funding is needed. We have said that we are going to allocate 20 billion rand to COVID-19, and that is going to work itself through the various budgetary reprioritization processes, but also obtaining the necessary funding from a number of sources. So funding should never be a problem. If it is a problem, it is a momentary problem. We have decided that COVID-19 is a war that we need to fight and win, and therefore we are going to allocate the resources that are necessary. And we note that you need up to 3 billion or so. Funding will be made available because you are the epicenter of this pandemic here in the Western Cape. So that will be addressed, and I'd like to see that addressed in the bringing in of more staff, putting in place more beds, tightening up on our hot spot strategy, making sure that we implement it to the full so that we get exactly the same results that we are getting at Witzenberg. But all in all, Premier, if we focus on all those areas that, yes, you have identified in your strategy, what Minister Mkhize has also alluded to, and the areas of more beds, more staff that I have raised here, and ensuring that communication is spread as effectively as possible, I am sure we will be able to address this. Now, the last part that I'd like to deal with is obviously at the social level. A number of our people are distressed. There's shortage of food. Many people will have lost their jobs. We do need, at all levels, to come up with an economic response. It does not only rest with the national government, the provincial government must also come up with clear strategies of how we are going to support the various places of employment, companies, to ensure that people do not lose their jobs. But at the social level, we do need to take care of those of our citizens who are facing great difficulties at the social level, where there is hunger, and we need to ensure that it happens at the community level, and we are responsive to the needs of our people at community level. And as we distribute food, and I'm glad to see that you've been focusing on distributing food parcels, but also the meals, as we do so right across the board, and we don't politicize the distribution of food, and we make sure that there is no corruption. We do it on the basis of addressing the needs of our people. That is critically important, because that is what needs to be driving precisely how we respond to COVID-19. So I look forward to the further work that needs to be done here. And I'm glad that Minister Mkhize will be spending more and more time coming here. And if there's a need, I'm willing and prepared to come back to see the way you will have moved forward to implement this. I want to see the success of Witzenberg being replicated in Khayelitsha and Overberg and a whole number of other places, so that we come on top of COVID-19 and we flatten this curve. The curve must be flattened. The whole country is focusing on what's happening here in the Western Cape, so that they can learn, but at the same time, we need to demonstrate that we can flatten the curve. And it is in our collective hands, all of us, as citizens of our country, but also as leaders, in government, as officials, we need to be doing precisely that. And with that, I want to thank you for the presentation and also for showcasing exactly what you're doing. And thank you for the work that continues to be done. May we all keep our hands on deck. The war is not over. This is a long-term war. It will probably take us 1.5 to 2 years living with COVID. And so therefore, we must not lose any stamina. It's a marathon that we are running to deal with COVID. But thank you very much, Mkhize.
Mr. President, thank you very much, especially for those kind words, but also if I can echo your words of thanks specifically to the front line. It is the front line of this war where it is our nurses, our police officers who are on that front line, and we really value, and I thank you for the kind words that you have put forward for them. I also want to say that front line is also echoed across our governments. It is not just our politicians, but it is our government officials who in this time are putting in many more hours than they've ever done before. I'm sure, Mr. President, you noticed those 3 o'clock in the morning phone calls and those 11 o'clock at night Teams meetings, and even the teams getting together before today, running late into the night, and that is happening 7 days a week. And so I really want to echo your thanks to all the frontline, and I want to join to say thank you very much. And it is still a marathon. We are at the beginning. We've got a long way to go. You said it's a war. You mentioned the province, the epicenter, and of course epicenters can change, or can I say the front line. And of course in a war, that front line, and thank you very much for the resources that you're talking about. And also your oversight in saying, you know, you want to help us with extra beds or make sure we get the funding right. It is to make sure that that front line is resourced in this war. And of course, that is going to be an ever-changing front line over the months to come. We see our colleagues in other provinces also starting to deal with numbers that we were dealing with a while ago. And we've got to help each other, as you say. We've got to do this together. And so can I really thank you for bringing your ministers, for pledging your support, and specifically those ministers that over the last few months have been also in that front line in this war, making sure that we are dealing with it. I hear what you say about the extra beds, the contact tracing, the Q&I, and we're responding to those issues, and we will respond to the maximum. And thank you very much for the commitment on test kits, etc., so that we actually together find out we've got to raise these issues when we pick them up, and then we've got to deal with them decisively. That's the only way that you do win a war. Thank you very much also for recognition of the work that's happening across our governments. And I think you ended off with talking about our behavioral change that we need to put in place. This region knows behavioral change because everyone still has a bucket in their shower. And so, again, we have to make sure that our golden rules become the norm. It becomes how we lead our lives, especially over the next while trying to keep the curve as flat as possible. And so, again, we need to plead to every single person in this province to bring that behavioral change into their lives, make sure that they are washing their hands regularly, that they are hand sanitizing, and specifically wearing their masks and keeping social distance. And Mr. President, then your point about the economic or the socio-economic responsibility that we are going to have now, not to waste a crisis like this, but to make sure that we turn it into an opportunity. We already see the number of people who are put under tremendous pressure, and we really are going to be working day and night, not only to fight the war on this front, but also to make sure that we create opportunity for the future. And perhaps also what you're saying about, we talk about test kits and importing them, but we also have a health tech and a health innovation system and entrepreneurs in our country that are second to none. And of course, if we can give them the opportunity, not only for us here in our country, but also for the continent and the world. So thank you very much once again. If I can say to everybody here, thank you for being here as part of this cabinet. We are now going to be moving to the official opening ceremony of this health response as a hospital. I probably don't need to remind you because the President has said it, but I'll say it again, social distancing when we move. This is leadership here, and we have to show the country that we are adhering to it. And of course, I also have on my right-hand side Minister Mbombo, who will come down on us like a ton of bricks if we are not social distancing, correct? Yes, as she does. So please, we are